Hi, I'm Dr. Derek with Bismarck Advanced Dental and Implants. Consultation times, I'll be quite honest, this is more of a variable thing. Sometimes people come in and they truly need just one tooth that's been missing for many years, and we'll take a 3D x-ray, do a quick evaluation on them, and it's really a pretty easy situation. We'll give them an estimate same day of what it's going to cost, and then we can go ahead and get them scheduled. Other patients, maybe they've been missing their teeth for many years. Sometimes we have to work with their medical doctors. Not usually, those are very few cases, but it could be, we're trying to replace 28 teeth here, and we might be doing a combination of implants, or maybe we're going to crown some of their teeth in implants. And oftentimes people have a story they want to tell about their other doctors they've been to, and why it didn't work out. And so consultation could be as quick as 15 minutes, and it could be an hour and a half. But ultimately the goal is to answer the patient's questions, see what we can best do for them, and design them a treatment plan that's going to get them to where they want to be. Consultation process is typically where you're going to meet the doctor, myself. You're going to come in. My amazing team is going to introduce you to the office. We're going to take a 3D x-ray of your teeth. We're going to take some pictures of your mouth. And really what we're putting together is a plan that's tailored specifically to you. Typically, I come in and ask a question that most people don't hear from a doctor, and that's, what can we do for you? Most people go to their doctor and their doctor tells them, you need this, you need this, you need this, and here's where you're going to go next. For me, it's an open question. What can we do for you? For some people, they want to feel better about their smile. Most people, it's having to do with something they want to eat. Honestly, for some people, it may just be a single tooth, or the left side or the right side. We have many patients that say, you know what, my bottom teeth don't bother me so much, but I would like to focus on the top teeth. So, a dentist may say, well, geez, I would like to fix the bottom teeth. But honestly, if what's ever most important to you is the way I always approach these situations. So this you're going to hear this. You come in to meet us, you're going to hear the same question: what can we do for you? And then you tell us. So that's typically how we start. We always look at the patient's teeth that day. I've had this discussion with other doctors in other offices, and they say, no, I never come in and look at the teeth. My assistant is really great. She just talks to the patient and she gets them set up to get all their teeth taken out, or whatnot. Honestly, I never do that. I've never done that, and I never will do that, because probably don't need all your teeth taken out, or maybe you do, or maybe you've already had your teeth taken out. So I need to have that conversation with you so we could best get you where you need to be in the most efficient and cost-efficient manner possible. So to me, that involves taking a little bit more time on the front end, so we're not trying to fix something at the back end. I know this is not the way that other places do it, but this is the way we've always done it, and we will always do it this way. Patients will often want to know, how much does this cost? Because whether you see a typical family practice doctor, or you see a general dentist, or you see a specialist, you always get charged a consultation fee or a treatment fee. They're going to charge you for x-rays to see the doctor. I'm not sure if this is the best way to do it. In the 16 years I've been practicing, we have never charged a consultation fee, but because for us, we try to lower as many barriers to entry as we can. I realize this is not for everybody, so we'd like to just get a chance to meet you. You can meet us, get a feel for our office, and see if what we can do for you is going to benefit you or not. For the great majority of patients, they do sign on and they decide to do treatment. For some patients, they say, you know what, I can't afford this, or maybe I don't want to do this, and that's fine. It's totally a complimentary consultation for all those people. For imaging, we'll typically use all three types of imaging, and it's going to be a 3D x-ray. We're going to do a 3D intraoral scan, so we're basically going to get pictures of your mouth that we can use to plan your case. And we're also going to take photos of you. And the photos are mainly so we can design your smile, what it's going to be before we even begin treatment. We're going to put all three of these together, and that's kind of where we ultimately design the plan, the teeth for you. The intraoral scan and the 3D will be done same day, so will the pictures. But when it comes to smile design, you know, I will work with a team. I have a dedicated team of designers that are very professional, and this is what they do, and they work on designing your photos or your teeth from our photos. Patients often want to know, well, how much time do I have to spend coming back and forth? Do I have to go to multiple offices? Are they going to tell me how much it's going to cost? When are they going to tell me? We always set something up for you that day. So you will know before you leave what is this going to cost. Most often I do what I can to give patients two options, sometimes even three options. So for an example might be, well, you have you're missing some teeth up on top and some of them are broken off. We'll give you an option where we could restore them, maybe with fillings and crowns, or maybe we can take them out. There gets to be a point where sometimes people, they don't want to fix their teeth anymore. They've had multiple failed root canals, or they've had problems with decay, so they don't want to fix their teeth. So we're going to give them an option for implants. We're also going to talk to them about, well, maybe we could restore these teeth with crowns and bridges, and we'll give them pros and cons to each. So you most often will get more than one treatment plan. You know, we'll talk to you with what you want to do and what's best, and then let you decide of what your treatment's going to be. I'm very open with patients that I meet for the first time, and for sometimes I will even say, maybe you should go to this other office depending on what they're looking for. An example might be, well, I've read I can get a pair of dentures for $300, and I say, well, you know, that's great. If somebody can do that for you, you should look into them, and I'll tell you, hey, here's going to be the pros and cons of that. You know, of course, it never ends up being that because there's a bait and switch and this and that. So a lot of times these places aren't upfront with their treatment plans. As far as dental implants go, patients have many options of where they can go for this. A typical general dentist will say, we work with this oral surgery office, or we work with that oral surgery office, and they'll give you an initial fee that is not always, but most oftentimes lower than ours, the fee that we are presenting them, but it's only half the fee. So the oral surgeon is going to give them another fee. The combined fee is much more than what we charge in almost every case. In addition to that, we make all the teeth here. So I will typically do them over my lunch break, after hours, or even on the weekends. So what does that mean? So that means you get very attention to detail, but if there is ever any problem, we're able to fix it or even remake your teeth. We say, well, you're going to have to pay more. That's typically what the general dentist will do who does this, because they really have no cost. They're going to get charged again from an outside laboratory, so they're going to pass those costs on to you. In the very few times we've ever had to modify or remake someone's teeth, you know, we don't charge for this, because ultimately it's about getting you to where you want to be. So so that's kind of how we're different than some of the other people who try to do this.